It's kind of exciting, right? Because we're the first of its kind to the market.
Mm-hmm.
We're the first ones utilizing a neurostimulation in this way to target
Mm-hmm.
what we're specifically targeting. Across the board, what we're most excited about is people are finally starting to say, oh, it doesn't have to be drugs. I think that's the most exciting thing for us is tech will continue to evolve. Tech will continue to be solutions. So right now, a lot of health tech is reporting data, right? Even your period tracking apps, those are just giving you data and they're feeding you back the data. What we're excited about is that our tech is the then what? We're the solution. We're the treatment option on the other side. And data is only good if you then know what to do with it. And then you feel empowered to go find a solution. And so we're excited to be on the solution end of the tech world.
What's up, ladies? Welcome to the Health Class She Deserves, the show where we ditch outdated women's health myths and talk real bodies, real cycles, and real stories. I'm your host, Autumn Payon, and today we are speaking with the VP of Strategic Growth at OhmBody. OhmBody is a wearable wellness device created to work with your body, not against it. Using science-backed, drug-free neurostimulation, it supports full body balance and comfort by gently activating your body's natural ways of managing pain, mood, digestion, energy, and flow, resulting in a smarter, multi-system approach that doesn't just mask discomfort, it taps into your body's own intelligence to bring relief from the inside out. Amy, welcome to class.
Yeah, Autumn, thanks for having me. We're excited to be here.
Awesome. So let's jump right into it. I said some big words in the introduction, like neurostimulation. Sure. Can you describe what neurostimulation is?
Yeah, neurostimulation is just essentially sending really low frequencies of electrical pulses down the nerves. And for us, we target two specific nerves and their auricular branches, meaning the branches around their ear in your body. So the two nerves that we specifically target are first the trigeminal nerve. She's the nerve that helps you manage pain and helps your body understand the pain that you're feeling. So that's the first one. And those branches are actually located right in front of your ear. So just right in front of where your ear canal opens. The second branch that we target is the vagus nerve. Now, she's real popular. Your vagus nerve is your only cranial nerve that leaves your body, touches every major organ in your body, and then sends those signals and those sort of communication pathways back up to your brain. So it's kind of this information highway between your brain and your major nerves. And everyone out there is trying to optimize their vagal nerve, right? We're doing these like massages. We're doing, in some cases, pulsing. So for us, it's neurostimulation of that. But it's all about, hey, we're finally beginning to understand. And what lots of cultures outside the United States have understood for a long time is that your body is all interconnected, right? And it's all about balance. And if we can naturally begin to help balance our internal processes, then we actually help to heal ourselves a lot better than pharmaceuticals can often do that. So we target the vagus nerve. And so in the combination of those two things, we're actually able to help women experience less heavy and less painful periods, which is exciting.
Yeah, that's very exciting. So all the vagus nerve hype, it's not just a buzzword. I feel like it's difficult to tell sometimes. Yeah.
Yeah. No, there's a lot of, and there's years and years and years and years and years and years of research around various things from epilepsy to strokes to blood loss now to, digestion. Like there's just so much that your vagal nerve touches. And for us, what we've been able to do is really untap the power of that when it comes to helping women through their menstrual cycle.
That's amazing. I love to see these types of things like targeted specifically at women's health because it's been so neglected for so long. And so when we have this really cool new technology and people are like, first order of business, helping women.
Yep.
That's where we need so much help.
Yeah, and we feel really fortunate. So we're the women's wellness division of a larger company called Spark Biomedical that uses neurostimulation in a myriad of other human conditions. And when they first really began to understand that, like, oh, our tech, coupled with some licensed tech from the Feinstein Institute and backed by like 20 plus years of research, could actually mitigate blood loss and help affect platelets and help platelets clot better. They were really, we sort of stumbled into a menstrual cycle or a menstrual care product, but they were really looking at like, how do we prove out in human models, because it only ever been tested in animals, how do we prove out in human models that we have the ability to help the body clot more efficiently in order to lose less blood, right? Because a healthy human has more blood in them than a non-healthy human, right? We want to keep as much blood inside of you as you can. And so really they were targeting around bleeding disorders and traumatic blood loss, both in injury and surgery. But like, it's difficult to imagine a surgeon allowing us to be in their surgical wing, waiting for someone to have a traumatic bleeding function, right? To then test this tech that's unproven. You're right. So they're like, where do we go? And with people with bleeding disorders, you don't want to cause a bleed because that could be detrimental in so many ways to their health. And so they're like, how do we do this? And a female hematologist came to them and said, you should really study this in women with von Willebrand disease. And these women bleed up to 1 liter of blood every time they have their cycle, which is an astronomical amount of blood to lose. But they were like, they bleed every month and you're not causing the blood, but you know that cycle is going to show up every month. And they're like, oh, that's interesting. So they're like, they're really just with women because they're like, oh, this is a place where we know women bleed monthly and we're not causing that. There's no risk to us like creating more blood. We're just going to see if our tech can affect that. So when they went through that process and saw the outsized returns of 55% reduction in blood loss on average in menstrual blood flow, a 20% reduction in the amount of blood or in the amount in the number of days women were on their cycle. And then additionally, because we're also balancing the autonomic nervous system, which we can get to, we saw reduction in cramping, mood swings, anxiety, sleeplessness, cravings. So all the other things that also come along. And our 3 founders looked at each other like, oh, we don't have a blood reduction product. We have a menstrual care product. And they were like, okay, yeah. And luckily for us, they're 3 men with daughters. They only have daughters. They're just dads of daughters and wives. And they're very passionate about bettering the future, obviously, for these young women that are in their own lives. And so they were like, yeah, let's run this. And so OhmBody was created out of that. And they hired me to come in and sit on podcasts like this with you, Autumn, and I lead the strategic growth portion of the company or of the division. And so, yeah, I'm grateful for 3 men who looked around and thought, yeah, we have a way to help a lot of women. So let's go do that.
Yeah, absolutely. And I'm kind of like giggling to myself over here. Like, this is why we need women in the room, because how is it not their first thought when they were like, blood loss, but we can't, cause people to bleed? If only there was half of the population that bled on a monthly basis in a completely natural and safe way.
Absolutely. Yeah, absolutely. And again, I'm so grateful for their humility to be like, yeah, okay, right. Let's go try that. And they joke about it a lot, which is why I can openly have this conversation, because they're like, yeah, it just never occurred to us. I'm like,
that's so funny.
That's okay.
It's okay. And it's like it's not your fault either. It's like how we're all raised really with this stigma. Yeah.
Well, and it's, I say this a lot. People research and invest in things that matter to them, which is, to your point, Autumn, important that women need to be at the table in order to bring forward things that matter, right? And so this is why we need female clinicians and female investors, and why we need to continue to make space for women. And I'm not saying there's not space for men, because I think jointly together, we have to be able to solve problems. But for so long, the only people at the table were men. And so the only problems that were being solved, or that were the forefront of this is why we have so many erectile dysfunction drugs, because men were researching and giving money to that, right? So it's just this, and I say this a lot too, and if men bled from their penises once a month, we'd already have a cure, right? Like it just would, or we'd have a better way of managing it than we currently do. And so, but I'm excited, and I'm so honored and thankful to be at a company where, despite the fact that we have 3 male co-founders, they are like, how do we help more women? And hey, let's bring more women. I think our company is like 60+% women across clinical engineering and our kind of marketing teams. And that's huge, right? And so we're able to sit down and say, a week does not go by that I don't go to our chief science officer and be like, hey, let's talk about how our product affects period poops. And he's like, tell me more about period poops, right? Like, he's like, how do we... Right. Tell me more about that experience, right? And so I'm so grateful to be working for founders who are like, we recognize that we don't have all the answers. We recognize that we don't have all the experiences. And I think until more and more founders and investors and clinicians can be open to that, it just takes a climb. But I'm grateful to be in a company that is the anti of that.
Yeah, it's amazing, and it's arguably rare, but
we think it's growing.
Changing.
But yeah, it's changing for sure.
Yeah. And like you said, it is also really important, because obviously it's important to have women at the table and marginalized communities at the table to get all these different perspectives, because just better outcomes happen that way. And that's well documented. But it's also really important to have the men also listening and amplifying
right.
our voices just because of the way the system is currently
Mhm.
is built to, listen to them and amplify their voices and not really anyone else. And so we need men at the table as well, like the founders, OhmBody being like, yeah, we need to listen. This is a big problem. This is affecting half of the population. It's not this obscure thing. It's
That's right. We're not a niche market.
right. Exactly. Yeah. I was just talking to somebody the other day who she's building a company um around it's like self-reported health data to like really get
Okay.
better health solutions instead of you because the current system is obviously, like we said, not set up for women. And she was saying the same thing. Like somebody said to her, like, well, this is so niche. And she was like, actually, everyone's telling me to niche down because I'm talking to 50% of the population. That's
That's
an
right.
enormous number.
That's right.
And he kind
That's
of was
right.
like put in his place. And she was like, yeah,
Yeah.
okay.
Yeah. Women's health is not niche, guys.
Yeah,
If you don't know that, women's health
right.
is not niche.
Not niche at all. It is so true. So for the product of OhmBody, like
Hmm.
it's a wearable device, right?
Yep.
So is it bulky? Can you wear it to work? Like, what's the deal with
Yeah.
that?
Can your listeners see me? Am I
Yeah,
gonna
it will be on YouTube as
Okay,
well.
so
So
sorry those that are listening, but go to ohmbody.com and you can see all of this. We utilize this really small, really discreet earpiece. It's daily disposable, so you put it on for the 2 hours that we recommend you wearing it, and it sticks to your either side of your ear with a hydrocolloid. So think like a really sticky Band-Aid, essentially, or like a gel pad. And what we do is we wear this little thing, and it's connected to a device that's smaller than your cell phone. She's real cute. She almost looks like a small child's like toy cell phone.
yeah.
Like it's truly that light. And this device hooks up with a cable to that earpiece I just showed, and super easy to wear. You put it on, put it in your pocket, and go about your day. It's really designed to be a grab and go. I wear mine in the mornings when I lift, the first 3 days of my period, and so I can lift. I put it in like a little spy belt, super easy. I eat my breakfast, drink my coffee, and then after I'm done with 2 hours, I take it off and I shower and get ready for my day. And then I don't have to take this with me. But say you start in the middle of the day or you need some extra support through the day, this is super, super easy. I've worn this to the grocery store, I've worn this to meetings. And when my hair is down, you can hardly tell that it's there. If the wire bothers you, just stick it under your shirt, just like you would any other cable, mic wire, or whatever, and then put it in a pocket. So it's really easy. It's not cumbersome. It doesn't require you to be hooked up to a wall. This is powered by 3 AAA batteries. And all she's going to do, so we're not collecting your data on this. This isn't a period tracker. We're not keeping track of how much you're bleeding or when you're using it or any of those things. All this does is that it helps the user to be able to control how intense they feel it. So we want it to feel sort of tingly, but a soothing tingle, sort of like when your foot just falls asleep and just on the edge of your foot, you feel just that little bit of tingle. That's what we want it to feel like. We want it to feel good though. So you control how intense that feels for you and then how long you wear it. So you can set a timer up to 24 hours on this and she can just go, which is great.
Wow. Is
Yeah.
there like a safe limit? Like, are you not supposed to wear it for a certain, like too long or?
No, so
Wow.
our tech in a different frequency is utilized in a different use case, and those individuals can wear it 24/7. That use case is for individuals withdrawing from opioids. So when you're withdrawing from opioids, your body is in hyper fight or flight, meaning your body is literally telling you, I think I'm dying, you need to give me more drugs. So you're not actually craving drugs, you're craving the release of what your body is feeling through the withdrawal. And so what we're able to do is by balancing the autonomic nervous system there, we're actually able to help balance that stress level for them and bring them out of fight or flight. And in order to do that for them, they wear it 24/7 until they've completely withdrawn. And today, we've been around since 2018. We've not had a single adverse reaction to that outside of like some skin irritation from, if you're a little allergic to the adhesive or you've had it on for too long in terms of that. But and then every once in a while a headache, but usually that just means someone's has it turned up too high, so they just crank it back down, and that usually resettles itself. So yeah, no adverse reaction. We do recommend 2 hours. We have some users who say, oh, I feel great within 20 minutes, and they're like, I want to take it off, and we're like, oh no, keep it on for 2 hours just to allow your body to completely balance out. And then but we have some users who say, I need a little extra today because I'm cramping. My cramps are really severe. My sympathetic tones feel really out of whack. And so they'll wear it for 3-4 hours. We have some users who wear it 2 hours in the morning, leave their earpiece on because they maybe work in an office or whatever. And then later in the day, when the halo effect of the cramping has kind of subsided, cramping reduction has subsided, they'll plug themselves back in for another 2 hours.
Okay.
Yeah.
Wow. And so is it throughout the cycle that you wear it for like best
That's a
results?
great question. So we recommend wearing it any day that you menstruate or that you need symptom relief. So we have some people who cramp leading up, right? Leading up to their period. So the first 3 days prior to, they're cramping pretty severely. So we recommend you wear it then. And then some women who wear it all 7 days. I have a 5-day cycle. I'm perimenopausal. So I have a 5-day cycle. I wear mine the first 3 days. First day to clear brain fog, because since I turned 39, 40, my brain fog is like intense in perimenopause. Nobody warns you about that. But by the way, if you're not perimenopausal yet, brain fog will be a real thing for you. And I say that as a high functioning woman who like sometimes can't remember what I'm looking at. So it clears my brain fog on day 1. My second day I wear it because I went from being a pretty moderate bleeder. I didn't start till I was 17. I had like 3 to 4 periods a year through my 20s, balanced out in my 30s. I hit perimenopause and suddenly I was flooding my disc. A disc should hold 12 hours of blood, and I was having to dump after 2 to 3 hours, which is not normal. But since using OhmBody on day 2, I don't flood out of my disc. I can wear it 12 hours like a normal person should be wearing it. And then on day 3, it's hit or miss. Some days or some cycles, I'm still bleeding, and so I put it on or, and manage that. And some cycles by day 3, I'm like sort of spotting, so I don't need my OhmBody. So what we love about OhmBody is it's customizable to every woman. And we're not here to say, get rid of your birth control, get rid of your drugs. We're here to say, let us complement those things because we recognize not every woman is on birth control simply for period management. There's contraceptive reasons, there's other health reasons. And so we certainly, but we're meant to be a companion to that. Or for some, like a 15-year-old girl who's a heavy menstrual bleeder, like we want her to have her mom and dad to have a non-hormonal option to pathwaying through menstruation and a heavy bleed. So we're really excited about being able to offer something that is drug-free, that's non-hormonal and non-invasive and truly customizable to every user.
Yeah, that's incredible. And also, I mean, as somebody with endometriosis, ovulation cramps are a thing.
Yeah, absolutely.
For a lot of us. And I can imagine that would be like really useful because those sometimes they're not as bad as my menstrual cramps, but they're less predictable. And so like, it'll just
they're disruptive, right? Because you're like, hey, today I needed to be able to get XYZ done. And my endometriosis flare-up is so intense. And so we have some users that are actively using it to manage their endometriosis flare-ups and have really shared that it's the only thing that provides them relief. And some of those individuals will wear it all day because they're just like, I don't want to risk I don't want to risk having a flare up in it. So they'll just wear it through the flare up. And we've been really pleased to hear their feedback on that. So we're excited. So right now from a clinical perspective, and I do want to share with your listeners, like you started by saying, so we're science backed. We are a science first company. Period. Our clinical team and engineering team are in-house. They make up the vast majority of our employment status. And we're really, really proud of that. Our first trial was just published in Frontiers in Medicine. We're happy to share that link with you, and you can put it in your show notes if you want, Autumn, and people can go in. And it's pretty techy, but the abstract is pretty easy to read. So, but in that is where we saw the results that I talked about earlier, the 55% reduction in blood loss, the 20% reduction in the number of days, and all of those things. So knowing that we're clinically backed, peer-reviewed and clinically backed, we just wrapped a second clinical trial that should be published hopefully very soon. It takes a while to get all the results and write up that thing. So that'll be going. But what we're really excited about is our pivotal study, which will go live, which will begin early next year. We were just funded by an organization called Welcome Leap. If you're familiar with women's health at all, they just announced a $50 million fund in order to find solutions for menstrual pain and relief in non-hormonal and non-invasive ways, which is just our company. That's what we already do. And so we were one of 13 institutions to receive funding from that fund. And we're the only non-research institution, meaning we're the only commercially backed company that isn't a research institution or a university. And so what that means for us is that it just proves out the efficacy of the clinical work being done by our chief science officer and his team. And I think for us, that's so important. I tell people this a lot. I would have never signed up to come to a company that was going to make false claims to women because this world is full of them, right? In a world full of pseudoscience and snake oil and anything to sell to women because we've been left to our own devices for so long. We'll do anything to be 1% better.
Oh
And
my God, yeah.
we'll literally try anything to be 1% better, especially women who suffer greatly, heavy menstrual bleeders, PMDD, like women who truly, truly suffer through menstruation. And what I'm so proud of is that our company is so focused on our science, is so focused on the clinical results. And it's so important to us that what we're putting out there is real and is effective. And we recognize that not every woman may respond to OhmBody. So that's why we have a 60-day money back guarantee, no questions asked. That should give you time to use 2 cycles. And if you're like, hey, this isn't working for us, if it doesn't work the first cycle, we would ask that you reach out to our customer service team, obviously, and let us make sure you're using it correctly. Is it a device failure? Is it like, what is it? Let's talk through it. But if it doesn't work for you, that's okay for us too. We never want you to hold on to something that isn't working for you. And we highly recommend you talking to your doctor if you have concerns. Like it's so important to us that every woman understands that like we are not here to take your money. What we're here to do is help you find solutions and whatever that looks like for you. And so, yeah, I'm just really proud to be a part of a company that's like, listen, women have been fed shit for too long. And we're not going to be a part of that. And we're not going to add to that. So, and then our clinical study that I was talking about for next year will be half women with heavy menstrual bleeding with von Willebrand disease. So it'll be 40 women with that. And then it'll be 40 adolescents, ages 14 through 17 with heavy menstrual bleeding. Because we recognize, right? Like nobody wants to give their 14-year-old daughter hormones to manage a cycle, right? Like we want to give her the best possibility to be fertile someday if that's what she decides to do, or to just be healthy and for her hormones to be her own. And we're not pushing her with something that, isn't in her body and isn't of her body. And so we're really excited about that. And that will be for us to go after an FDA indication for heavy menstrual bleeding specifically. So that'll be our first sort of hurdle. But then after that, we want to go after solutions for endometriosis, PMDD, PCOS, perimenopause is a focus for us. I think mostly because I'm a perimenopausal woman and I'm like, we have to have a solve for this brain fog that I can't seem to get over.
Yeah.
So we're excited about, we think heavy menstrual bleeding is just the tip of the iceberg for us in terms of where we want to head with our research.
Yeah, that's incredible because, well, especially with the young girls as well, there's so much discourse around it. And I feel like people get really kind of, like prickly around the idea of hormonal birth control because of all of the things that it's offered women. And like, we always want to respect that and stuff. And it's I always say it's such a personal choice, but there is a really disgusting like lack of informed consent when it comes to birth control. And it's given out way too early, way too often. And that, in my opinion, is inarguable. That's just the truth. And when it comes to conditions such as endometriosis, when a 13, 14-year-old girl goes into her doctor and says, I'm in so much pain, I can't go to school. It's during my period. It's at other times that like I don't have my period. It is affecting X, Y, and Z. It's super heavy, whatever it is. And your doctor just says, okay, here you go. This will, quote, regulate your cycle, when no, in reality, it gets rid of your cycle. And, if it's that bad and you're anemic and, really obviously it can serve a purpose. But a lot of times the cases aren't that extreme. And there needs to be more investigative care into like, why? Because then by the time they're in their 20s, 30s, potentially trying to get pregnant, all of a sudden they go off their birth control, or endometriosis comes, all the symptoms come back full force. It's spread like crazy. And it's like, no one ever told me that wasn't normal. They nodded their head. They handed me a pill. So
That's right.
Having an option like this and I know this is newer and there's definitely not data on this yet, but in terms of it supporting your body and kind of helping your body's natural processes, I wonder if, in however many decades, if you guys were to collect data on whether or not it helped slow the spread of endometriosis.
Yeah. And we don't know that. And that's what we're excited to really think through. And I think you're right. So we didn't really talk about how OhmBody works, which we could do really quickly. But when you talk about the natural processes, I want your users or your listeners to really understand, like, what does she mean by that? Natural processes. I bleed. That's normal, right? And while, yes, that is right, for sure, there is a baseline of normal bleeding, right? If you're bleeding more than 80 milliliters of blood a month, a cycle, so that's just over a quarter of a cup of blood. If you're bleeding more than that, you're a heavy menstrual bleeder. And we would encourage you to go see your doctor and tell them. Because a lot of women, for a lot of reasons, don't know they're a heavy menstrual bleeder, right? Like their mom bleeds that much, their grandma bleeds that much, their aunt bleeds that much. So it just feels normal. And when you go to your OBGYN or your gynecologist, they're rarely asking you outside of, are you bleeding and when did you bleed? Those are the two questions they ask you. They don't ask you how much you're bleeding. They'll ask you how many tampons are you going through in a day, or most don't. I think there are some that are beginning to do that, but for the majority of them, they don't. So when we think about that, so for us, when we talk about helping your body do what it does naturally, so one of the things that OhmBody does is by stimulating the vagus nerve, we actually send signals down to the spleen. The spleen at any point holds between 20 and 30% of your body's platelets. Platelets help you clot. That's their job. They show up when you have a point of injury. They keep you from bleeding out. They help you internally. When I clap my hands together, platelets are going right now to my hands because I've created an injury, right? So they're constantly churning and burning, churning and burning. And so what we are able to do is we send signals down at the spleen to these little platelets, and we're actually able to prime them in such a way through our signaling so that when they show up to clot, they clot faster, stronger, and hold longer. We don't throw a clot, we don't make a clot. So there's no worry there because we're not activating them. We're just priming them in such a way that says, hey, when the body calls you to a point of injury, so in this case, the shedding of your uterine wall, you're going to show up there and be really, really efficient, which then slows the amount of blood loss that is expelled. And so that's the first side of what we do. So again, your body's already clotting, right? Platelets are already going. What we're doing is we're simply priming those platelets so that they do it more efficiently. Again, we're just supporting what your body already does. The other side of what we do is by signaling the trigeminal and vagus nerve, we're actually able to balance the autonomic nervous system. So one of the reasons you feel like crap during your period is because your sympathetic tone, your fight or flight tone is in overdrive. Because whether we like to think about it or not, your body's experiencing trauma when you go through menstruation. It just is. And for some women who are having menstrual bleeding, if they were to lose as much blood as they do from their uterus each month from any other part of their body, they'd be in the hospital receiving treatment.
Right.
They just would be.
It's true.
And so your body is naturally saying, Mayday, 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 we have blood, right? Even though it's natural, even though it's supposed to work, sometimes our bodies can go into a super fight or flight sense. And so we get increased cramping. We don't sleep well. We get anxious. We get mood. We get all these things that our body is starting to do because we're sending all these resources to our uterus. So what we're able to do is by raising the parasympathetic tone, which is your rest and relax tone, we actually help your body come back into balance and experience menstruation in a more calm state. We don't keep you from menstruating or ovulating or doing any of the things that are necessary for you to be healthy, right? Because we know that menstruation is not simply about having babies. Mm-hmm. You need a healthy menstrual cycle to be strong, to have the right bone density, to have the right body composition, to be able to just function. You need a balanced menstrual cycle. And we know that. And so by helping your body come out of the stress mode, we're actually able to lower all of the fight or flight pieces, which then lowers your anxiety, your sleeplessness, your crampings, your mood swings, help you sleep better, helps you not crave things. And also we feel brings your overall body of systemic inflammation down as well. And so it just, again, helps your body do what it already does. Your autonomic nervous system should be balanced unless you truly are in danger, right? Because that is our body's mechanism of protection. But you're not in danger when you're menstruating. And so your body shouldn't feel that. So we're bringing you back down. And so again, we're just helping your body do what it does naturally. So we just want everyone to understand is like, when we say that, we truly mean that. And so when you're talking about what does the future mean? What does that mean for us over a long usage of, a long period of usage? Yeah. I mean, I think we could logically come to a conclusion that your body will sustain better over time when it's not fighting itself in every month in these like hyper stress situations. So we don't know that just yet. I think we have some hypotheses around that of what that could look like. But logically, we could say a body in less stress will perform better over time.
Right. Yeah. That's incredible. And I think when you're saying like about the trauma, like your body going through trauma with menstruation, I don't know how, like, if you would know about this or not, but with ovulation too, I know there's new research now showing that it's actually kind of a violent process when the follicle bursts. It's not like this gentle thing. So I wonder if also people who experience ovulation symptoms, because my anxiety is the worst for me around ovulation.
Yeah.
Not my luteal phase, like a lot of people.
Yeah, interesting.
So, and I wonder if there's some sort of connection there as well.
Yeah, that's curious. I'm going to take that back to our chief science officer. Again, I take him something pretty much every week. But yeah, I mean, again, this idea of like hyper fight or flight, your anxiety, your body going through stress. Yeah, we think we have options to be able to help women in those spaces. But again, the research will continue and it will, we may get there and be like, oh, we actually understand the mechanism as this. And so can we do that? And that's what I love about our company is we're so small. We only have 24 employees. So we're not this huge, massive company. And so because of that, we can take questions like yours to our clinical team and say, what do we think, guys? Is this something? And they may already have an answer, or they'll go see like what other research is being done there. And can that help inform the research that we want to do? And so again, we think we're just sort of scratching the surface in the women's wellness division. And that's part of the reason that, Spark Biomedical, our parent company, could have said, we have this product, we're going to release it as a product of Spark, go. And what they found was like, oh no, if we're going to do women's health, let's do women's health. And they started a whole division, right, with this whole mission around how do we better help women. Our tagline and our brand tagline is because life doesn't stop when you start. Right. And so this idea of like, how do we help women continue to be the badasses they are in that space? And so we're going to start with menstrual health first and heavy menstrual bleeding first. But then what is the next frontier in that? And we recognize, again, because unlike men who have a 24-hour hormonal window, we have this like very long, multi-day, multi-week cycle, and every woman experiences that differently, right? Like we could be the exact same age, exact same experiences, but our bodies are still going to express hormonally different. We just will. And so we recognize that, and we're committed to, we understand that the fight, or that this research is a long road ahead because there are so many variants. But we're committed to that and excited to see what might come out.
That's amazing. It's so great that that there are companies out there that are so committed to helping women and to filling the gaps in the research, especially any chance that I have to participate in any sort of research, like just surveys and stuff. Like I'm always doing it because I'm like, we just need more data from women. Yeah, from the women specifically, because the data that we have from the current medical system, at least here in the United States, is not.
Well, we talked about birth control earlier. I'm 40, so I'm of the generation where birth control was given out like candy. You had acne, you got birth control. You had heavy periods, you had birth control. You were anxious, you got birth control. And that birth control was developed, studied, and then perfected, quote unquote, on white middle-aged men, because until 1994, women and children weren't required to be in clinical studies for drugs related to them because, women are complicated and our hormones are complicated, and we complicate clinical studies. We just do.
We're expensive.
And clinical trials are expensive anyway. So you add the layer of, women and complications in women. And anyway, it's a lot. And so to your point, like there's so much of what we're doing, even, when we think about wearable data, right? Like I wear this, I won't say the name, but I wear this device and it gives me things about my sleep and my recovery. But oftentimes I wonder, are my baselines from other women, or is my baseline an algorithm that was based on men? And then how true is that then, right? So we love a company that's coming out that is incredible. They're calling Cora is their name. They're a wearable earring. You can search them. They're amazing, but they're a women's only health tracker. They're going to be a health wearable. And what I love about them is that they are for women, by women, and only with women data. I mean, they're truly like these beautiful, stunning earrings. And we'll continue to get more companies like them that are like, yeah, women are different. So like, let's create algorithms and baselines that are based on women, And I love the device I wear, and it keeps me on track, and I'm a little data obsessed. Data is only as good as the baselines you create from them and the data that you're putting in, right? So the algorithms and the formulas you're putting in, that data has to come back. And so if you've not created it at baseline for women, what you're putting out isn't helpful to women.
Yep. Yeah. And I think about that a lot too with like blood tests and stuff and all the things they test for that, because they have different values for men and women. So it's a little misleading. But what a lot of people don't understand is that women historically have just been viewed as tiny men instead of completely biochemically different beings. Like you can't just take the numbers for men and then shrink them a little bit.
That's right.
It's not simple. And unfortunately, that's what a lot of data and health recommendations and nutrition recommendations are all based on. And it just is not at all. It's not
right. Yeah. I say this a lot. If I can grow a baby, birth a baby, and feed a baby inside of the ecosystem of my body alone with no other assistance, and a man cannot, that fundamentally makes us different. Screw the fact that he has a penis and I have a vagina and I have breasts, and like the kind of breasts that I have, like take all of that out. It doesn't matter. That doesn't matter. But just like from a physical, I can birth a baby and then sustain that baby all in this body. And a man could never.
Right. Exactly. So how on earth are we just taking
how are we
these
just tiny
numbers and
versions?
right.
We're not tiny versions. And in some cases, there are incredible women out there who are incredibly strong that are bigger than men, lift more than men, do more than men, or more powerful than men. So like we can't just like, to your point, it's not apples to apples for sure.
Yeah. I'm curious more from like the development side of things and like in the company. Like, I mean, is it correct to say that tech companies centered around women and women's health are not super common, right?
I would say that while they're not super common, I think it's growing, which is exciting. It's hard for me sometimes because I'm in the world, so it feels like our whole world is women's health.
Right.
But from, last year alone, less than 2% of the investments from VCs went into women's health across the globe. Like that's a very small amount to not be investing in half the world's population. So it's coming. It's sort of, somebody said the other day that it feels like women's health is sort of this like sexy thing right now. And I'm like, that makes me sad. I'm excited because it's bringing attention, but I'm like, I hope it's more like a fundamental need across the board. And again, as the Bill Gates Foundation puts money, as Melinda Gates Foundation puts money, there's more attention certainly that is coming. But, as long as VC firms and investors view women's health as niche, they view it as a risk. Niche markets are risky. Unless you just have a unicorn that you can prove out, it's hard for people to say, oh yeah, I want to invest in that. And so you get, companies and founders who want to go into women's health, but the money doesn't follow that, right? Again, people invest in and create or innovate in spaces that matters to them. And so, but when your innovation doesn't match, your innovative need doesn't match the investment need, there can be a challenge there. So it is incumbent upon companies and I think continued advocates for women and legislatures and PACs and different things to say like, no, we have to continue to bring the light on it. It's not, and this beating of this drum of like women's health matters. And women's health matters in such a way that it affects all of us, right? So like we talk a lot at OhmBody about the cost of menstruation and the cost of heavy periods on an economy and what that can look like. So we, there's research out there that talks about these women that have excessive symptoms. So it's about 26 plus million women in the United States alone with excessive symptoms, excessive enough that they miss 8.9 days of work a year due to menstruation. So they stay at home. Either the cramping is so bad, they're bleeding through their pants, whatever that reason is, they're missing. We actually think that number is likely underrepresented because most women aren't telling their company CEOs that they're missing because of menstruation. And then that doesn't include, so that's absenteeism, but we talk a lot about presenteeism, right? Women who go to work, sit in front of their computer, but that they're performing at 70% of their normal ability because now I'm worried about bleeding through my pencil skirt sitting in a boardroom or whatever it might be. And so that economic cost is really unrecognized, again, because lots of CEOs are men sitting in the number one seat, and that's the last thing they're thinking about, right? And nobody in their C-suite, even women in their C-suite, are raising their hand and saying, excuse me, your P&L means nothing to me today because all I can think about is not ripping Ted's head off because my hormones are raging and my period pain is so bad, right? Like nobody's having that conversation because that's when you get, well, this is why women shouldn't be at the top seat. This is why women don't belong in the room. This is why women are emotional, right? There's all this like cultural stuff that keeps us from having this conversation, right? But when we look at it and we did some like really rough numbers just on the back of a napkin. One day we're like, okay, if it's 26.5 million women missing 8.9 days of work and the average salary is this and what this looks like. Well, we did some just very, very rough calculations. So don't quote me on it, but we were looking at $44 billion plus loss of economic gain, economic productivity every year because we don't account for that, right? But I think that if CEOs across the world, across the country, and let's just start with the United States, were to say, wow, $44.5 billion is a lot of freaking money that's going out because of an unaddressed situation with our female workforce. I think if they really understood that, I think the conversation gets changed a lot faster.
Yeah.
But we have to keep having the conversation. And I liken it to when, if you can remember a time, you're probably old enough to remember this one, there were no nursing rooms in stadiums and offices and corporate offices. And it took this groundswell of movement, this real grassroots movement of women saying, hello, I'm coming back to the office 6 weeks after having an infant, and I have milk coming out of my breasts, and I have to be able to do that, not in a dirty closet and not in a bathroom. Right. But if you can imagine, like I remember being a kid and was never working, but over the last 20, 25 years of my life and my professional career, slowly seeing that become a very common practice, right? I live in Waco, Texas. Baylor University just did a whole mom's room at their stadium, an entire breastfeeding mom's room, right? That was unheard of 15 years ago because why can't you just use the bathroom? Well, that's not exactly sanitary. And have you ever sat in a bathroom that long? Like, just that thing. So I think when we look at menstruation and the issues surrounding that of presenteeism and absenteeism, I think continuing to have the conversation is going to be so vital for us to then make the gains that we need.
Absolutely. And I think it's like meeting the system where it's at, meeting the kind of money hungry capitalist. It's sad that it has to be that way, that it can't just be like, oh, this should be a basic human right. It's like, no, look how much money this can make you. But honestly, whatever gets the job done. Yeah. Not even to mention all the healthcare costs. And I mean, that's a whole other conversation, the way that
we could do a whole other session
off our illness. Yeah.
That's right.
So they don't want us to be healthy. But at the same time, it's, endometriosis alone costs a crazy amount of money.
Sure.
To the government, the healthcare system. And I mean, my surgery alone, like if I didn't have insurance, was quoted at like $32,000.
Which is wild, right? That's a car for some people.
Yeah.
I mean, and that's a salary for some people, an entire year's worth of salary. And so when we think about, for us, a solution, again, we don't know what our impact on endo will be, quite frankly. But if our device can help women, the cost comparison of a $30,000+ surgery to our $575 device, it's almost laughable, right? Of like, oh, could we actually provide a solution that allows women to do that in their home, to not have invasive surgery, to not have to take more drugs, to not have to manage it in the way they've been managing it, in this really simple, easy to use, sort of holistic approach is really exciting for us.
Definitely. And while we're talking about the cost as well, I did want to ask for people listening who maybe are like, that's kind of a high price point for me. Do you have payment plans, insurance, HS?
Yeah. So no insurance. And there's a reason that we haven't gone that route for reimbursement. We've actually found that because we do have reimbursable products in our company. And what we found is that when we make a product reimbursable, so that means for your listeners, that means your insurance covers it. It actually makes it very expensive for people who don't have insurance, quite frankly.
Okay. Wow. Yeah.
So yeah, because when you do it through insurance, now everyone needs a cut. So you have to make the price high enough that everyone gets a cut of the actual product. So, and there are great things about reimbursement, and we have insurance, and I'm so grateful, and that covers a lot of things. But right now we're a wellness product, and direct to consumer. You can buy it from us directly, and so to help manage the cost to come down, we've decided not to go that route unless something proves out. But in our current pathway, that's not. But we are FSA HSA eligible, so you can use your Flex dollars directly on our website, and we do have payment plans. Which is great. And so you can actually use your FSA HSA dollars on both the kit, the starter kit. So it comes with the device, a cable, and 7 disposable earpieces. But you can also use your Flex dollars on the earpiece subscription as well. So we have a couple of options on our website where you can buy them month to month. You can subscribe. So that gives you for them to come every month. That gives you a little savings. Or you can buy them in bulk. So say you're a mom with 3 daughters, you all menstruate, you buy one device, and then you just bulk buy earpieces, which is so nice. Okay. So you can sort of do that. We have 2 stickinesses. We have our classic, which is our 4 to 6 hour hold. So if you're at home or you're in the office, you're not planning to be anywhere in high humidity, the classic is perfect and works just fine. Our active is for those, just like it says, are active women. So if you plan to, work out in it, so if you plan to walk or be outside in it, if you live in a high humidity place, or you're going to be going all day and wanting to wear it all day, we would recommend. And you can mix and match. Maybe classic is for your everyday. That's what you do normally. And you keep a few active just to be like, oh, hey, today I'm actually going to have to be out and about. I want to make sure this sticks on my ear. You can wear that as well.
Okay. And so they're all single use?
They're all single use. And the reason for that is the circuits are printed directly into the earpiece, which is kind of cool. So when you pull it open, you're going to actually be able to see the electrical circuit lines directly in the earpiece in the plastic. And so the hydrocolloid that sticks on there is there to protect you and keep you from being shocked. And that's the most basic way to say that. And so with the wear and tear, as you pull it off, that stickiness begins to fade. And we just want to keep people safe.
Yeah, right. All right. So neurotechnology specifically for women's health, obviously a very like a newer emerging field. I'm curious where you think it's headed in the future, not just with OhmBody, but just kind of on a larger scale, where you think we're headed in women's health and femtech, I
Yeah.
guess.
Yeah, I think that's a really curious question. I think the answer is I don't know. It's
Mm,
kind of exciting, right? Because we're the first of its kind to the market.
mm-hmm,
We're the first ones utilizing neurostimulation in this way to target what we're specifically targeting. And we, for us, it's like, how do we make it smaller? How do we make it more wearable? So for us, there's like some things in the future that we're really excited for. But across the board, what we're most excited about is people are finally starting to say, oh, it doesn't have to be drugs. I think that's the most exciting thing for us is tech will continue to evolve. Tech will continue to be solutions. So right now, a lot of health tech is the what? Like, is reporting data, right? So your Whoops, your Aura Rings, your Apple Watches, they're giving you data. Even your period tracking apps, those are just giving you data and they're feeding you back the data. What we're excited about is that our tech is the then what? We're the solution. We're the treatment option on the other side. And so we're excited to see what continues to come out of that, where it's not just giving you data, because gosh, we're so overrun with data sometimes. Don't you feel like that? You're like, everywhere I go, someone's giving me data. And data is only good if you then know what to do with it. And then you feel empowered to go find a solution. And so we're excited to be on the solution end of the tech world. But it's an exciting time. And again, I think, this idea that it's 2025 and we're just now coming up with things that feel very simple. We get this a lot at OhmBody where people are like, wait, why is this tech just now coming to light? I'm like, yeah, I know. I feel you. It's a great question and I feel you. So we're excited to sort of be on this. I feel like we're just sort of on this. I talk a lot about this like big wave coming at us, right? And we want to be on our surfboards and paddling so we can catch that wave really well. And that's what I feel like femtech is currently right now too.
Yeah. Yeah. It's so exciting. And it's like, yeah, why didn't we have this sooner? And you're like, it's not even a technology issue. It's not like we lack the technology. It was a social issue. Like we lacked the women in the room to care about these things. So yeah, it's so incredible. I think it's headed it's so quick. It's like so rapidly, rapidly developing field. Even neuroscience itself is a baby in the grand scheme of things. And so it is really, really exciting to see this stuff being targeted towards this. And like you said, with the data, like I'm always preaching, like, your body best. Collect the data on yourself, whether you're writing it down or you have a tracking app or whatever it is, like you need that, because as a woman, when you go to the doctor's office, especially with cycle related issues, you're not always going to be taken seriously. In fact, more often than not, you're going to be given like an SSRI for some crazy intense pain, which makes no sense. And so I'm always like, you want to collect all this data on yourself. But I love what you said about like being the then what on the solution side of things, because, a lot of women and myself included have been failed by doctors. And I have a team of doctors now that I love and I'm so grateful for. And, there are great ones out there, but I have been failed by quite a few doctors in my past. Yeah. And the Western medical model is not built to benefit the patient at all. And while it can provide life-saving care, things like this that are more like long-term solutions before I would ever need life-saving care.
Yeah, that's right.
Is so incredible. So thank you to OhmBody and thank you so much for being here and for sharing this all with us. I do have one question that I like to ask all of my guests at the end.
Great.
If you could rewrite the health class curriculum that every woman deserves, what would your first lesson be?
Gosh, I feel like there's just a lot of things I would have rewritten. I think that the thing that I would rewrite is that, I have so many things, but I think really in line with OhmBody is that menstruation is not something to be hidden away. Mm-hmm. And that it's more than just about having babies. I did not see a gynecologist until like before I got married, because my mom thought I was still a virgin. So, there's that. And so, I just grew up in a very religious, deeply Southern Baptist society. But the minute I had a period, I should have been taken to a gynecologist. Mm-hmm. Yeah. And I wasn't. I didn't even know that was something I should have done. I should have learned that in health class, though. I should have learned that in my A&P anatomy and physiology class. I took human anatomy and physiology as a senior in an AP level course. And the only thing I remember about that class is a birthing video where I watched a baby crown out of a woman. And I thought, I never want that to happen to me ever. Yeah. And so I'm child free. Like I truly, I think that at the deep core has traumatized me. But the fact that that's the only thing I remember about a woman's body in a human anatomy and physiology class is mind-blowing. And I learned nothing about menstruation in that class.
Crazy.
Not a thing. Not
and
one. Not one thing.
Graphics and stuff are all like male bodies as well.
Male bodies only. That's all I remember saying. I remember one chapter where it was about the uterus and ovaries, but I don't remember learning that. And, you know, we talk about this stat a lot, that we're partnering with a company that we're excited to announce soon, but with some educational pieces. And they shared a stat with me that said 78% of girls leave high school knowing more about the anatomy of a frog than they do about their own bodies. And that is an insane stat. That is an insane stat. And this idea that we are spending, I mean, I remember the anatomy of a frog. I used to babysit, and I had these boys, these rambunctious boys, and they found a dead frog. And I said, well, let's dissect it. And I literally went through the anatomy of a frog as a 16-year-old because I could. But if I had had a human body sitting there, a female human body, I wouldn't have been able to do that. I mean, that would have been a very different babysitting experience. But, you know, but I'm just saying, like, I truly, like, you know, I remember dissecting pigs. I remember dissecting frogs. I was an ag kid. So I've been around birthing calves, and like, I've done that. And I knew more about that. When I heard that stat, I was like, gosh, I think that's true.
Yeah.
I think that's, and I'm an educated woman. Like, I have a master's degree. I've traveled the world. I read like all the time. And I have learned more about my body and the female anatomy in menstruation, specifically, obviously, in this role, since I took this role in January than I did in my previous 40 years of life. And that's a problem, Autumn.
It's a huge problem.
It's a problem.
It's so relatable. Like, you are in the majority in that sense, you know, like, and it's so sad just how little we know. And I, like you said, like, I'm college educated, and I've traveled a lot, and I read all the time, and it's just, there's so much we don't know that you can do all the research and all the reading. It's like, we literally just don't know it at a research level. We don't have data to back up a lot of things. And what we do know is not being taught. And imagine if, like you said, if we taught young girls at a really young age that menstruation is not something to be hidden. If they have to go use the bathroom because they're bleeding, they can raise their hand and say that, and they shouldn't have to hide their tampon in their sleeve.
That's right.
Imagine how much more like empowered we would all be if we embraced it. And I would even argue that we'd have less cyclical related issues, because I do
100%.
Yeah, there's such
because when we don't talk about it, when it's taboo, I don't feel like there's a safe place for me to go tell, hey, I think I'm bleeding too much, or hey, I just passed a clot the size of my fist, right? Or my cramping is so bad. This is not about me being a baby. Like, this is not a suck it up and deal with it. Or, you know, like, there's, to your point, there's just so many things. When we don't talk about, when we make it taboo, the problems get larger.
Yes. And there's the you know, trauma component of that, of
oh my gosh,
the body keeps the score, and you know, having all of that shame and stigma just like balled up in your womb space, that's going to cause more issues.
Yeah, for sure.
Yeah, so that would be an incredible lesson that I think we all should have. I didn't go to a gynecologist either till I was in my 20s.
Which is wild.
It's so wild, and it was scary. Like, it was, I can relate to the religious thing, and I had such like a disconnect with my sexuality and with that part of my body, even that we
could do a whole podcast on purity culture.
Right.
I'm sure.
No, exactly. Like, at that point, I think by the first time I went to the gynecologist, I had only like just started wearing tampons regularly. Because I was so disconnected from that part of my body. It freaked me out. I didn't like it. So the whole idea of going to a gynecologist was just so terrifying to me.
Yeah. And no, and again, like, it's just this idea. But again, when you put shame around something that is naturally occurring, that's the result that you get. Right. And, you know, I spent my freshman year at a religious university, surrounded by mission kids and preachers' kids, and the things, I mean, just mind blowing, right? I'm like, I don't understand what's happening.
Yeah.
And I was like the quote unquote liberal kid, and I was like, oh, I grew up pretty conservative. Right? Yeah. And you're like, well, I don't think that, you know, and then that leads to things about not understanding sex, not understanding, you know, how to prevent pregnancy, not understand, you know, like, there's just this whole, like, I mean, it just cycles through it when we make the vagina shameful.
Exactly. And just because you aren't educated about sex and how to prevent pregnancy doesn't mean that kids aren't going to have sex. Like, I don't
100%.
know why people think that that's a proper way to like prevent. And then it also goes into this whole thing with like the consent issue that we see with young
Yes,
boys that grow into men these days.
that's right.
Like, not excusing it, but also at the same time in the culture they were brought up in and the things that they were never taught,
Yeah.
it's not surprising that they act that way.
Yeah, for sure.
It's yeah, there's such a larger conversation there, and I do think that it could all start with just destigmatizing a a woman's body. We could just lead the revolution. I do think that that's like the
100%.
missing piece for so many young girls and women of
Yeah.
like not of being like kind of radicalized, but like not quite. It's like that's the missing piece. It's like own your period and
Yeah.
you could conquer the world.
Yeah, for sure.
This has been such an incredible conversation.
I've
Thank you
loved it.
so much for being here.
Oh my gosh, thanks for having me.
Of course. I will link everything for OhmBody below. So all you listeners can go check that out. If you have any questions about anything, please reach out to me, autumn at thehealthclassshedeserves.com, or on social media or anything. If you have any questions for Amy, I'm happy to pass them along as well. Because I know that some of this was a little bit techie. So if people still have any questions. Also, OhmBody's website is incredible.
Yeah.
There's so
And
much information
reach
on
out to
there.
us on social too. Our social team stands at the ready, and we love having conversations with our users or people who are curious about us over there. Please come
Mhm.
over, introduce
Yeah.
yourself, tell us you listen to this podcast, and we'll chat all the questions that you need.
Yes. Awesome. And I will link that for everybody below. Thank you guys so much for listening. I will see y'all next week and class dismissed.